Okay, in this presentation, we're going to discuss the skin disorder of moles or melanocytic nevi. So moles are known as moles. However, they are melanocytic nevis or nevi. They're also called pigmented nevi. These moles are a disorder of the melanocytes, which are pigment-producing skin cells. They can be all different colors, shapes, sizes. They can be flat, raised, or rough on the skin. However, some of these can be dangerous or cancerous. They're very common and usually appear and develop in early childhood and throughout teenage years. So the causes of moles are when melanocyte cells grow irregularly. So these cells grow in a cluster instead of being spread out throughout the skin like they normally are. They can develop at birth or after long exposures to sun's UV rays, which damages the skin and damages the melanocytes. So congenital nevi are present at birth. These are more likely to develop into cancer than moles that develop after birth. And then dysplastic nevi are generally larger and more irregular in shape than average moles, and they are also more likely to develop into cancer than average size and shaped moles. So here's two side-by-side pictures of congenital and dysplastic nevi, so you can see the differences between the two. So symptoms are skin marks and discoloration. They can appear anywhere on the body. They're self-diagnosable because anyone can see that they have a mole. However, they can develop into cancerous moles, which is rare, but this is not necessarily self-diagnosable. But yes. So the abcdes of moles. This is 5 things that you can use to see if a mole changes into an unhealthy or cancerous mole. So if any of these match characteristics of your mole, it could be cancerous or dangerous. So the first is asymmetry, which stands for, well, A stands for asymmetry. This is where one half of the mole is not symmetrical to the other. And then B for border, where a mole has irregular or more blurred edges. Then C for color, where the color is not the same throughout, it changes, or it is an abnormal color or shade. D for diameter, the diameter is larger than a pencil eraser, that is not good. And then E for evolution, where the mole changes in these characteristics over time. So yes. Here's another image of these 5 words that you can use to see if a mole can be harmful. Okay, and treatment. Most cases do not require treatment because they are not harmful to your body. They're just there. Some cases can require removal of the mole if the mole develops, or just for cosmetic reasons, you may want the mole removed. So removal can be through freezing the mole off with freeze spray or liquid nitrogen, or surgical procedures such as surgical excision or surgical shave. Moles can be prevented by blocking your skin from harsh UV rays, using sunscreen or protective clothing. However, you can't prevent the ones that you are born with. Yes, obviously, if the moles become cancerous, you will need that mole removed, and cancer treatment can become necessary if it develops enough. So the quality of life with someone with moles is normally very good. Many people think they are unattractive or not cosmetic. So people can feel insecure and bullying can occur because of the cosmetic looks. However, they are not you're not in harm's way if you have a mole unless it is a cancerous mole or harmful to your body. So my news article I found was from the Women's Health magazine. They talk about Dr. Pimple Popper, who is a dermatologist that is very outspoken on Instagram and social media about skin disorders. She works to help her patients feel more comfortable in their looks and more normalize unpleasant skin conditions, because it's something that we all have to deal with, and she just wants everyone to feel better about it themselves. So in a recent video, she used a removal procedure called the surgical shave to remove a mole off a patient's face with a very sharp scalpel. So this is what is discussed in this article. The article discusses other ways that a dermatologist could remove moles, with information from the American Academy of Dermatology. And yeah, they just are talking about making sure everyone knows how moles can be removed safely, and just to normalize these skin conditions. And yeah. So here we have a little mini quiz. So the first question is, how and why do moles occur? And then our second question is a fill in the blank. So blank nevi are present from birth. And then our third question is, what does each letter in the ABCDEs of moles stand for? So I'll give you a few minutes to think about that, and then we'll go over the answers. Okay, and here are our answers. So number one, these occur because of a disorder of melanocytes, where the cells grow in clusters and can be caused by UV rays or just be present at birth. Our second one is that congenital nevi are present at birth. And then our third is asymmetry, border, color, diameter, and evolution. So good job if you got those all right. Okay, and there are my references, and thank you very much for watching.